Hey everybody, Mark Stewart here, physiotherapist based here in the UK. Forget My Body Working YouTube channel. Today we're going to talk about low back pain, how I treat it and how I sort it out for all my patients that I see in my clinic. Now, low back pain is a massive source of pain and disability for many millions of people throughout the world. But believe it or not, it's very, very simple to sort out. But you've got to know what you're dealing with in order to sort it out properly. So remember, you need a specific solution for your specific problems. Now, in this video, I'm going to take you through how I assess someone's low back pain in my clinics. Simple as that. I've been doing this method for about 15 years now, and I find it unbelievably successful, and I hope you benefit from it as well. Now, before we move on to assess your low back pain, we need to talk about the red flag signs and symptoms that low back pain can present. Now, these are very rare, but they're very serious, and I need you to take them really, really seriously, okay? Now, in no particular order, but in equal importance. So, number one, pain, tingling, numbness, weakness, going down both sides, so both legs, bilateral symptoms. This is a massive red flag. I need you to consider going to A&E as soon as possible and get this checked out. Number two, tingling, numbness in your genital region, a massive red flag. Nerve compression to these organs, really, really serious stuff. You're going to A&E and get those checked out, please. Number three, difficulty passing urine or opening your bowels, massive red flags. Get yourself to A&E. Stop watching this. This is not the place for you. You need to go and get checked out. Number four, if any of your back pain symptoms started after an accident, which could be a slip, trip, fall, car accident, and it's not getting any better, you really need to get yourself to A&E and get yourself checked out. Now, of course, there are lots of other red flag symptoms. You can always Google those. The NHS has an excellent resource there. I'd suggest you go and check those out. If you're ticking any of those boxes, stop watching YouTube videos, get yourself to A&E straight away and get yourself checked out. They'll be more than happy to do that for you. Now, before we move on, I just want to make you aware of the disclaimer that's in the description of this video. Go check that out, follow what that says before we carry on. Okay, everybody. All right, well, let's crack on and get your back assessed. Now, the most common causes of back pain, as far as I'm concerned, boil down to the muscles in your nerves, in your lumbar spine area and your gluteal region. They, for me, are the big culprits of what causes your back pain. I know a lot of people are now yelling at the screen saying, I've got a prolapsed disc, I've got a slipped disc, I've got osteophytes, I've got arthritis. That may be the case, but I'm pretty sure you'll also have dysfunctioning muscular and nerve system that's causing significant amounts of your pain. The muscles and the nerves are what we can address with physiotherapy. We can't change your disc, we can't change your arthritis, but we can certainly get muscles more flexible and stronger, which will in turn relieve your nerves, and those symptoms will settle right down. Now, I can hear some of you saying, I've got an SIJ problem or sacroiliitis. Now, the question is, why do you have SIJ problems or sacroiliitis? I would suggest to you that the muscles that support that big joint aren't working very well at all. They're probably too tight, they're probably very, very weak, and the downside is that irritates the joint and you get significant amounts of pain and nerve irritation from that. So unless we address the cause, which is the muscles and the soft tissues around there, we're not going to get on top of that pain. So keep watching, and that's exactly what we're going to do. Okay, everybody, now let's assess your back. Now, first of all, make sure your symptoms have settled down to an appropriate level so you can actually engage in what we're doing here. If your symptoms are through the roof, you need to get some painkillers on board, do what you need to do to get them under control before you have a go. I have, however, had people come into my clinic barely able to walk and move, had to go with what I'm going to show you right now and walk up there happy as Larry, obviously not totally cured, but significantly better and on the road to recovery. So have a little go and see how you get on. Okay, now, first of all, let's talk about where the pain is. Okay, so I'm going to use my right side as my painful side tonight. Okay, so the most common place I see people complaining of pain is around this area in your lower back, your SIJ area, the bony bits around here. That's the most common place. Most of the time it's going down into your bottom a little bit as well. Sometimes it also manifests as raging sciatica down your leg, and sometimes it also manifests as pain going up your lumbar spine. So they're the most common places. Usually on one side, it might be a bit central, but biasing one side more than another. Okay, now if that's you, definitely strap yourself in. we're going to be on a winner soon. Now, the first thing we're going to assess is range of motion. It gives us lots of information about what potentially is going on in your back, and also tells me how irritable and severe things are. So, of course, if you can't move because it's really, really sore, very severe, we need to take it very gently. But if you can move reasonably well, then we can do a little bit more, okay? Now, take note of tight areas, because we're going to add those to our stretching list as we go on. Now, flexion, first of all, nice and easy, just bending forward, okay? Off we go, bend forward, down towards your toes. It's tight at the back of the hamstrings, that's pretty normal. How does it feel in the lower back there? If it's tight, we're doing some stretches there. Stand yourself back up, okay? That's flexion, nice and easy. Now, okay, next one is extension. Hands on your bottom, leaning backwards. How does that feel? Okay, it might feel just squashed and sore in your back. If it aggravates the pain down your leg, okay, just be gentle and careful, all right? But that gives us some good information about how irritable things are. Now, if your movement's very good so far, so good, it's probably not the spine that's the problem, it's probably more down in your glute regions. Okay, side flexion. So this is my left side, my right side. So we're going to go to the left, first of all, over to the left. How tight does it feel on the right-hand side? If it's mega tight, we're doing some stretches here, okay? And then over to the right, so it might feel a bit squashed and sore there, so we know things are a bit irritable. We need to be a little bit sensible and careful. How does it feel on the left-hand side? If it doesn't bother you on the left-hand side at all, that's my good side for tonight, then that's what we're aiming for eventually. All right, so range of motion, simple stuff, gives us some good information. So let's quickly summarize. So anywhere that was tight in there, we need to make a note of that, because we're going to give that a stretch later on. Now, any area that didn't like being squashed or sore, they're probably a bit irritable, so we just be gentle with those, but hopefully they respond to some of the stretches we're going to do in just a minute. Okay, now the first muscle group I want to talk about tonight is the Quadratus Lumborum, or the QL for short. Okay, now that is a sort of a sail-shaped muscle that goes from the middle of your spine out to your pelvic wing there, up to your 12th rib there, and then back to your spine. Sort of like a squashed rectangle, all right? It's very good at side flexion, and together they work with flexion, and it's a common source of incredible pain in your lower back, and it can get very, very, very tight. Okay, now the stretch for your QL is fairly straightforward. I'm going to use my right side tonight to demonstrate. Yours might be your left side, or you might have both sides that aren't very happy, okay? Now, of course, if it is very tight, we're definitely adding that to your stretch list. Now, very simply, I want you to bend forward down to about where your knees are, and then I want you to lean over to one side. Now, I'm going to my left because I'm stretching my right side, and I'm having a feel of how the right side is. It's very, very tight, so I'm writing that down on my list to have a stretch later on. Okay, now if it's your left side, bend forward and over to the right to assess your left. Okay, and of course, do both sides, comparing good and bad. And of course, if the bad side's really tight compared to the good side, you're definitely adding that in, and we're stretching that until it feels as good as the good side. Okay, now the next muscle group are your gluteal muscles, specifically your piriformis and your gluteus medius muscles. We're going to sit down for these. Okay, everybody, I'm sat down now. So, piriformis, first of all, right leg to go first. So we're going to simply cross your leg over the other one. Lovely polka dot socks there. Okay, now we're going to sit up nice and tall, push your knee down, and have a good old lean forward as far as you can. Okay, now I want you to have a feel of how tight it feels in your bottom, and more importantly, does it reproduce any of your symptoms? Okay, so again, sit up nice and tall, push that knee down, have a good lean forward, give that muscle a really good stretch. How tight is it? Does it reproduce your symptoms? Now, if it does, bingo, you are on the money right here. So we're going to add this one into your routine, and this is going to sort things out for you big time. Now, the next muscle group we're going to stretch is just all the other gluteal muscles. Okay, so grab your knee, pull it across your body like that, down there, give it a good stretch. How does that feel? Now, does that reproduce any of your pain, or is it giving you a good stretch in the area where you normally get your pain? If the answer is yes, magnificent. We are on a winner here. Now, your glutes are a big muscle. It's a bit like one of those Japanese fans, okay? So one position isn't going to stretch everything. So we're going to try a couple of positions. So straight across up in the middle, that's that one. Maybe pull your knee up towards your chin, over to the other side. That can be quite tight. Add that one in. And then the last one is having your knees together, pull everything over across your body and stretch a little bit up there. See how that feels. Write all those down. If they're tight, we're definitely adding those in. Okay, that was my bad side, mega tight. Let's try the good side now. So piriformis, this is my left side. Leg up there like that, polka dot socks in full force, sit up tall, push your knee down, good old lean forward. Yeah, that's tight. Okay, now for me, that's nowhere near as tight as the bad side. So this is the good side. I'm aiming for that sort of flexibility there. Okay, now glutes, grab your knee, put your knee across your body. Nice stretch in there. That's not too bad, nowhere near as tight as the bad side. Okay, other positions, knee up and over, stretching, yeah, it's tight, not as bad as the other one. And then the last one is your knees together, pull your knee across your body, and how does that feel? Fantastic. Now, for me, that is the big one. If those muscles are really, really tight and the bad is worse than the good side, you definitely have to add that one in. I'm pretty sure if you improve the flexibility in that area alone, you'll find massive improvements of your back pain within few sessions of stretching it, maybe 24, 48 hours, maybe a week or two. But if you don't address the tightness there, you're not going to get anywhere. All right, that's your glutes. Now we're going to have a quick look at your hip flexors, another massive area that contributes to back pain. Okay, everybody, now hip flexors, what are they? Now, your hip flexors are muscles that essentially flex your hip like that, okay? Now they attach on your lesser trochanter of your femur, right up here in your proximal femur area. They go across your hip and go into the iliac crest or the pelvic wing, and they also go all the way up your lumbar spine, all the way up to the top. So your psoas goes all the way up to the top, your iliacus sits here in the iliac crest, and together they form the iliopsoas, in other words, your hip flexors. Now, really, really important lumbar stabilizing muscle group, often overlooked, often forgotten, but often problematic in low back pain. And we're going to have a quick look at them now, okay? Okay, now we're going to give them a bit of a stretch first and see what that tells us. Now I'm going to stretch my right side first. So hands on your hips, all right? Step forward with your left leg, leave your right leg behind, lean backwards a little bit, and we're just going to bend your right knee forward and just give this area a bit of a stretch. You might lean over towards your left and just give things a bit of a stretch. How does that feel? If that's super duper mega tight and reproducing some of your symptoms, you're adding this one in. Compared to the good side, my left side. Okay, so right leg forward, hands on your hips, lean backwards, lunging forward. How tight does it feel on the right hand side? Here's a sort of a front view. Okay, so how tight does it feel down there? Lean over, away from it. Okay, that's your good side or your bad side. But if it is your good side like mine, it doesn't feel anywhere near as tight as the bad side. So I'm going to add that one into my bad side stretching list. Okay, now, if that wasn't too tight at all and you're thinking, what's the point of all of that? Let's get down on our knees and we'll see how tight it is down there. Okay, so I'm down on my hands and knees now. Okay, so I'm on my right knee, which is my bad side, the one I'm going to stretch first and test first. Left leg out in front. Make sure your foot's a little bit wide out in the front there so you have a nice base of support and you're not going to fall over. Again, let's have your hands on your hips, okay? And we're going to lean backwards and then lunge forward a little bit, okay, not very far. Stretching this area here. How tight does that feel? That's super duper tight, reproducing some of your symptoms. Boom, that's going in to your stretch list. If it's not too bad, lean over towards the left to stretch this a bit more. Maybe take your kneeling arm up and over. Give things a bit of a stretch. How does that feel? All right, very good. Okay, let's try the good side. So, swap legs, carefully does it. Front leg out nice and wide. Hands on your hips, lean backwards, lunge forward, lean over towards the opposite side, kneeling arm up and over. How does that feel? Nowhere near as tight as the bad side. So I definitely need to add that one in to my little stretch routine. All right, everybody, good stuff. We're getting there. Okay, guys, now the next muscle group we need to address are your thigh muscles, your quad muscles. Now, what have they got to do for back pain? Now, I had a patient come and see me during the week, and she had some significant pain going down the front of her thigh there, and it was due to the fact you had really, really tight hip flexors and also quad muscles. So we definitely need to add that one in there. It's definitely worth checking out. It may be something, it may be nothing, but you won't know until you try. So I'm going to hold on to my radiator here, okay? Other hand, grab your ankle there, whoops. Grab your ankle up tall, kick your leg out the back, angle towards your bum, give those quads a nice stretch. How does that feel? Not too bad for me at all. Try the other side. Good side. Yep, no problems whatsoever. I don't need to add that in, but if it's tight for you, you're definitely adding it in, particularly if it's on your bad side. Okay, last muscle group, I promise. Actually, no, that's a lie. We've got two more to do. Your inner thigh, or your groin muscles, and then your hamstring. So inner thigh, legs nice and wide, bad side. We're going to lean over to the left, stretch in there. How tight does that feel? Maybe turn towards the wall. Is it tight in there? Yes, you're adding it in. Try the other side. Not so bad. Don't need to worry about that one. Okay. And then the last one is your hamstrings. Okay, down the back of the leg. So you put your heel on the ground, stick your bum out, lean forward, reach down towards your toes there. How tight does it feel down the back of the thigh? And of course, the bad side. Try that as well. All right. Okay, everybody. Now that is all the muscle groups that we need to worry about for your low back pain. Those last two, not necessarily that common a problem, but definitely worth checking out. Quads also can be a bit of a problem, but for me, the biggest ones are your glutes and your hip flexors and your QL. So you've probably written those ones down. Hopefully, let's give them a good stretch. Okay, now how do you stretch your muscles properly? Now, as far as I'm concerned, you need to hold your stretches for at least 1 minute. And you need to do that breakfast, lunch, and dinner. So 3, maybe even 4 times a day for best results. Now, that's quite a lot. If you're like me, you can't fit that in all the time. So I like to hold my stretches for a bit longer, maybe 2 or even 3 minutes. And I find that works much better for me, and I can fit that in, and things do settle down. But see how you go. Everybody's a little bit different. Find what you works. Now, if you can stretch like that, you'll probably find your symptoms improve within 24, 48 hours, which is fantastic. Sometimes it can take a bit longer, a week or 2, but you should find that things are improving within a day or 2, and you're definitely on a winner if that's the case. Good stuff. Okay, everybody. Now, that's pretty much it for flexibility. Okay, so hopefully you've written down a few key areas for you to keep stretching. Make sure you keep stretching those because they'll really help and make a massive difference. Okay, everybody, now we're going to look at strength now. Now, strength for me is the most important way to sort your low back pain out. If your muscles are stronger, they can simply cope with whatever you want to do with yourself, and much better, and they won't get tight and cause lots and lots of problems. So we have to look at strength in fairly fine detail. Now, the major muscle group I'm looking at here is your gluteus medius muscle. Now, if you've never heard of that, if I turn around, it attaches onto this bony bit here and this bony bit out there, okay? It goes across your bottom like that. Now, its function, when you stand on one leg, is to keep everything here kind of level, all right? Now, if it's not doing its job properly, what will happen is it will get tired, it'll get tight, it'll pull on its attachments and irritate those, irritate the sciatic nerve, ask other muscles in there to work even harder, and they will get painful. And hey presto, you've got multifactorial low back pain. Now, as far as I'm concerned, glute med dysfunction is a major contributing factor to low back pain. And if we don't sort that out, we're simply not going to get anywhere. So that's what we're going to look at right now. Okay, now we need to lie down for this one. It's a maximal test, simply how many reps can you do, and of course comparing your bad side to the good side. All right, see you when we're lying down. Okay, everybody, if you've made it down to the floor or lying down, I'm on my Pilates mat here. It's nice and thick and comfortable. You can do this on your bed or the floor, somewhere relatively comfortable. It's a bit of a tough test. Like I said, it's maximal. We're going to see how many times you can lift your leg up in the air, and of course, we're going to compare good and the bad side. I'm doing my good side first, just because I've happened to end up here. If you want to do your bad side first, that's fine. Don't think it really matters. Okay, so here we go. I'm going to lie myself down, put my head on my hand there. You can have a pillow there. Bottom leg bent, top leg straight. You're going to roll your top hip forward so you show your bum to the ceiling. Okay, have your hand here on the floor. It doesn't really matter there. We're going to look at this muscle here in your bum. All right, So how many times can we do it? Okay, here we go. Nice big breath in. Off we go. 1. So we're simply going to count how many times we can do this. It's all about endurance. 6. Okay, we're just going to keep going. 9, 10. I hope you're doing it with me. 11, 12, 13. Now, I'm not going to do millions because I can do quite a few. 16. I'm not very good at counting. 17, 18, 19, 20. Oh dear, spoken too soon. It's getting tired. 22, 23. I can feel it right here in my bum. It's not going down my leg because I'm not cheating. I'm rolling forward. 9, 30. I think that's 30 anyway. I'm going to go all the way up to 50 and see how we do. 4, 35, 36, 38, 39, 40. Oh, it's getting a bit tired now. 2, 3, 4, 5, 46, 47, 48, 49, 50. Now, keep going if you can. I'm going to stop there just because everyone's getting a bit bored. But if you're still going, press pause and just see how many you can possibly do. Okay, we need that number. It's really, really important. I'll talk about numbers in just a second. Okay, now we're going to try the other side now and compare the bad side. So that was my good side. My right side's my bad side tonight. So I'm going to roll over. Have a go on the right hand side. Okay, cool. So let's have your head on your arm there. Bottom leg bent, top leg straight. Roll forward, show your bum to the ceiling. Let's see how many we can do on this side. Okay, ready? 1, 2, 3. Off we go. 1, 2, 3, 5, 6, 7, 10. And of course, I can feel it right here in my bottom here. It's not going down my leg, all right? I can pretty much relax my leg. 20. In this glute area, we want to feel working hard. 25. Only 25 to go. 9. 30. 2. Now, of course, we're going for endurance. 6, 37, 40, 10 more, 41, 42, 43, 44, 45, 46, 47, 48, 49, 50. All right, now do keep going if you've got more in the tank. Let's see how many that can do because we need to compare the good and the bad side. I've stopped at 50 just because nobody wants to watch me do as many as I possibly can. I don't really want to do as many as I possibly can either, because let's face it, it's a bit of a tough test. Now, let's talk about numbers. If you can't get to 30, that is a big problem because those muscles are simply not strong enough. Now, if you're taking 10, 12,000 steps every day and you can't lift your leg up 30 times, that is a massive contributing factor to all of your low back pain problems. Now, if your muscles on that side, that weaker side, the bad side, if they're also very, very tight, that's why they're not doing very well. That's why they're getting tight, because they're simply not strong enough. They don't have the endurance that you require to have a nice, healthy, happy lower back. So you've got to work on that little exercise there and build those numbers up at least to 30 and indeed beyond up to the level of the good leg. Now, 50 is always a good number to work towards if you're wondering, well, what should I get to? But ultimately, it needs to be much more than 30. Now, I had a marathon runner once who came in. He had some hip pain, a little bit like back pain. The only thing that was wrong with him was that when we did that little test, his good side did 250, but his bad side could only do 180. Now, his pain came on at the halfway marathon mark. And as he worked on that exercise and built his numbers up to about 250 each, he actually got to about 300 each next time I saw him. His hip pain went away. So it's really, really important. Now, you don't need to go and do marathons and you don't need to be doing 200 and 300 of those reps. You certainly need to do as many as the good side. And of course, it's not all about numbers, it's about quality too. So if you're aiming for 50 on the good side, and the bad side can get to 50, but the bad side's working really hard to do 50, I would always say, are you actually doing as many as you possibly could do on the good side? Could you possibly do a little bit more? Because it's not about numbers, it's about quality as well. Okay, everybody, now armed with all that information, you are definitely on the road to recovery. Give everything a good stretch that we've talked about so far. If you find that that muscle endurance there is lacking, we need to certainly address that. Now, if you are someone who so far has got to this point in the video and you're thinking, well, none of this seems to be affecting me, but I've still got this pain in your back, do not despair. There is one more little weapon I have up my sleeves that hopefully will be of benefit for you. Now, we're going to do another strength test, but it's of your tummy muscles, your core muscles. Now, don't worry, we're going to use a bunch of planks to tell us some valuable information. Now, the reason we're going to use planks is because they're quite tough. I don't like doing planks, but they're very, very useful and they've helped me sort out my lower back. And I've given them out a few times now and they've been very, very, very effective. Okay, so there's no point giving out an easy exercise because it's not going to get you anywhere. You've got to make the treatment pretty tough sometimes. I gave this out to a lady during the week and she's doing very well. I have you'll know. Okay, so planks, it's very, very simple. Now remember, my good side is my left side. My bad side is my right side. So how on earth do we use a plank to compare the two? All right, here we go. So first things first, let's get on our tummies. Okay, so we're going to get on our tummies into an elbow plank position. Flip your toes over. So we're going to push through your shoulders, of course, and we're going to come up and do a plank position and hold it there. Simple. Now, how do we compare left and right? Well, if I want to look at my right side, I'm going to lift up my left leg and hold it there. Whoa, that's a bit tough. Now, I want you to think about the effort involved in doing that. Pop that leg down and then lift up the right leg and compare the effort. Okay? Now, for me, that's pretty tough, but it's certainly harder lifting up my left leg than my right leg. Okay? Which means that these muscles in here on the right-hand side are not as strong as they are on the left-hand side. So I need to address that. Now, if you're not convinced, let's try a side plank test, okay? So side plank, over we go. Onto your elbow, leg straight, top leg out in front, top hand on your hip, okay? Pushing through your shoulder, chest down. We're going to lift up your hips, okay? Now this time, the muscles down here, just have a feel of how hard they're working. Okay, just hold it there for a few seconds, give yourself a good idea. Okay, working pretty hard there. Right, let's spin around and try the other side. Okay, top leg in front again, elbow, shoulder, chest out, hands on your hip, lifting up your hips there. Okay, much easier for me on this side. Okay, very good. Now, armed with that information, that tells me that I still have a weakness on this right-hand side, and that's great because that corresponds with where I get my back pain. So I stretch my glutes, I'm nice and strong in the glutes, but it's my plank weakness that is driving my symptoms. And of course, when I get round to it and I do a bunch of plank exercises and get things stronger, my back pain improves. So I'm my own worst patient, but I'm certainly getting there. Okay, everybody, that's another fantastic bunch of information I've just thrown your way. I hope it was fairly straightforward to follow, and you've got a notebook full of stretches and exercises and numbers that you can aim towards to help sort out your low back pain. Okay, so the dosage for strengthening exercises. You want to try and do those 2 or 3 times per week and slowly build up over a 6-week period. Make sure any discomfort you experience settles down before you have another go. Doing your stretches will certainly help with that. It will take 6 weeks to build your strength up, and it will probably take more than 6 weeks to get right on top of your symptoms. Now, there's nothing strange with that. It does take a long time to build your strength up, and it all depends on where you're starting from. So if you're very, very weak, it's going to take you longer than someone who's a little bit strong, and maybe their problem is just tightness. But if you are very, very tight and strong, you probably find your symptoms respond to all of this very, very rapidly indeed. Okay, everybody, that's it for tonight. I hope that's been very, very useful and you have a nice list of stretches and strengthening exercises to get your back sorted out. Be mindful of any red flag symptoms that come up and get yourself to A&E and get yourself checked out as soon as possible if any of those do arrive. As always, this is a bit of a long video, so watch it a couple of times to get a little bit more out of it each time, and hopefully that helps you sooner rather than later. As always, please hit the like button and the subscribe button for more great content when I've got it up and ready. And leave me a comment so I know how you're getting on. Okay, everybody, thanks for watching, and let's get your body working.